Most healthcare founders are working to solve the right problems. But what if they're building inside a system people have already stopped believing in? In this episode, I sat down with Dr. Taylor Evans, CEO of Wellness Equity Alliance, an infectious disease physician, associate professor at UCF College of Medicine, to explore why rebuilding trust might be the missing piece behind healthcare innovation that truly lasts. Healthcare entrepreneurs, are you ready to rewrite the rules for your business so you can have more time off, a great team, and more income while creating a positive social impact? Then you are in the right place. Welcome to The Provider's Edge. I'm your host, Sabrina Rumbach. I'm a provider, an international peak performance keynote speaker, and a best-selling author. Let's open the gateway to profitability for you today. My guests and I help healthcare entrepreneurs and startup founders like you break through barriers so you can control your business, control your life, and control your future. This is your defining moment to be a disruptor in healthcare. We have Dr. Tyler Evans here. He is the CEO of Wellness Equity Alliance and associate professor at UFC School of Medicine. His recent book, Pandemics, Poverty, and Politics, he exposed how inequitable fuels disease and how we can redesign systems to spread health. His work bridges medicine, justice, and radical public health reform. Thank you, Dr. Evans, for being here with us.
Thanks for having me.
So tell us a little bit more about why this book and why Getting Out Here Now.
Sure. So this book was really the culmination of, decades of experience working in the foxholes of really the inequities of health. I spent many years working in the global south or low and middle income countries, places in sub-Saharan Africa, the Middle East, Southeast Asia. And, my these nascent experiences started to formulate, a very strong opinion in terms of those inequities. But then when I came back to the US and started practicing mostly in HIV or anything that sort of intersects with HIV, which we now sort of refer to as syndemics, other diseases like hepatitis and STIs, but also mental health and substance use. And a lot of that's sort of fueled by the social drivers, particularly poverty. And so, I saw that there really wasn't many differences. While the scales of the magnitude of the disease burden were sort of significantly different, the reasons, or again, the drivers were very much the same. And I think that the tipping point, why did I finally sort of, get it out, was because I had served as the chief medical officer for New York City, overseeing the COVID-19 pandemic in 2020. And, with all of those resources, with FEMA, New York City, we still had a lot of challenges getting folks into our systems. And that was mostly because folks just didn't trust us, right? Because we were a government, even though it was a fairly progressive government, folks didn't trust us, and the systems were not set up for success. So it doesn't matter how much money you throw at a system. We do need more money, and we do need more kind of sustainable funding, but it needs to be very surgical and focused on the underlying sort of challenges. So that really, again, that was the final influencer in terms of my writing. But I see an opportunity. I'm always an optimist, and I see an opportunity to do better. So the book essentially outlines, it's sort of organized into three different buckets. The first bucket is really just describing what the social determinants or drivers of health are. This book is intended not necessarily for a healthcare audience, but for a sort of crossover audience, including, even undergraduate students. And then the second section is looking at, and I think this is the unique part, looking at the pandemics, starting from the third plague and moving to COVID-19. So over the course of over 100 years, looking at a number of how I define as pandemics, there's different ways of defining it, and identifying what the sort of, again, the common thread for all of these are. And I even provide the reader with a rubric for them to kind of grade whether or not the social and political sort of determinants contributed to this sort of pandemic. And then, hopefully I kind of influence the reader at the end of the second section. And the third section is like, all right, now that we're on the same page, literally, how do we respond? What's the solution?
Yeah, so definitely seems like it give people more of a tangible evaluation what it is. And I think sometimes the challenge for many people is they are reading, they're absorbing any information online, social platforms, and just opinion piece. And it's hard for any of us to know what is the ultimate truth, or are we actually discovering ultimate truth, or just simply confirming what we already formulate as what we believe in, right?
Mm.
And so you're giving people more of a rubric, more of a backbone to say, how do you even evaluate a situation like this that is across the globe, right? It's impacting so many lives. Doesn't matter how severe that is, right? It is still impacting and it's ongoing. You're giving people something to grab onto. And then we also talk about communication in anybody. There's actually three major things, right? There are the physical communicator, so which means we need facts, we need data, right? We make judgment on that things. And then we have those emotional communicator, they need stories, right? They needed to know there is a case study. How did it happen, right? Like what's that progression looks like, right? And in marketing, we call that a whole customer journey, right? Like take us, paint that picture for us. And then you have that spiritual communicator. They need to see the possibilities. What is that bigger impact? Or how does that feel for them to even be there? And so I think that's the challenge, is having all different person that have these innate languages, and then you start laying on human nature, right? Like the sabotaging tendency we have, or how we perceive the world, right? And then there are different measurements. So your book seems like it's giving people a tool, especially those of us who are very tangible, right? The physical communicator, to say, how do we actually judge and have a reason to create trust, to see situations as they are? Do you see the method that you created more for the public view, or is also for really everybody across the board?
Great comments. It's responding to some of your comments there. Yeah. Number one, just echoing literally what you said, pun intended. The echo chambers in which we sort of, exist in today's, modern form of sort of communication is deeply concerning, right? There's always been sort of tribal way of perceiving the world or phenomena. And so, this is evidence in a number of different ways, but, and that tribalism exists in so many different ways, whether it's your sort of your concentric circles of sort of sports or politics, or, different sort of influencers of sort of culture, whether it's, consumption, et cetera. But now it's been polarized or sort of, I guess, accelerated and further polarized as the result of social media. And we're not able to, people don't turn on objective media sources. People often sort of questioning, the sort of the truth of journalistic sort of integrity, et cetera, which is deeply concerning. So so it's hard to really kind of be able to distill what the actual sort of truth is out there. In addition to that, I think the book is demonstrating that this is not this issue of, social and political sort of determinants impacting healthcare, and that sort of driving infectious disease outbreaks to become epidemics to pandemics. And I've, evidenced this, a number of times throughout the book. And I framed it particularly to be a global issue, right? This is not an American issue. This is really a global concern. It is particularly concerning in the United States. And this is mostly where the sort of readership will sort of exist, but it is definitely global. The message of the book really is we need to depoliticize public health, right? And healthcare as a sort of intersection of public health. I've never seen this level of politicization of public health or healthcare. We've seen, I think historically in the United States, we've seen certain 3 or 4 different sort of, drivers of polarity of different sort of, populations, certainly abortion, borders, religion, guns. Who knew face masks and vaccines would sort of, be a sort of add on to that sort of cadre of different sort of contributors. So we really have to depoliticize, because public health is literally in the name. It is intended for all. It is a common good. And when you take it away, everybody is at risk. And then healthcare is clearly being impacted as well. And, unfortunately, in today's world, January 2026, that world, when we even say the 2 words public health, right? I feel like it's one of these sort of landmines, these political landmines, and it shouldn't be. It's odd. So the book is very timely, because the book, again, has been written sort of in my mind for decades. Finally got it out. Took, several years because of the sort of publishing process to actually get it out, but it could not be more timely, because given the fact that we are going so radically in one particular direction, we really need to, hopefully this is an opportunity for the readers to kind of zoom out and really understand this is based in evidence. We have to really invest in these drivers. We have to pay attention and start to address these, because if not, we're going to continue to have these pandemics occur. And I think that, for somebody like me, an infectious disease doctor who's been in the foxholes of a lot of these epidemics or pandemics, and seeing all the people, mainly, historically marginalized folks, poor folks in places like sub-Saharan Africa that are impacted by it, maybe people in the streets of, New York City or Houston or, Los Angeles, San Francisco, perhaps they don't really understand it as much. But guess what? COVID-19, everybody was impacted by it by some degree or another, right? At least everybody was one degree of separation away from this pandemic. So I think it was really the equalizer of the perception of risk. And whereas, your HIV, your malaria, your tuberculosis, et cetera, could not necessarily impact the minds of a lot of these folks. And the last piece I'll say is you mentioned data. I'm a physician scientist. I'm often sort of, backing up my sort of messages with evidence, with data. I mean, we're trained to do that. Every paper that I write, it's all sort of evidence with data. My book is evidence heavily with data and references and objective information. The problem is, in today's world, there is an attack on expert opinion, right? I've never seen this before, but there is this attack on expert opinion. It's not just science, but it's really on a number of different sort of areas. And, without getting into the politics too much, I think we really need to stand our ground when it comes to expert opinion, right? Physicians are physicians for reasons. Medical providers are medical providers for reasons. Epidemiologists are epidemiologists for a reason, right? It takes years, if not decades, to master these crafts, right? And we're able to sort of filter through the noise, right, of a lot of the stuff that, sure, a lot of intelligent people can pick up a study and say, oh, it says this, but it really takes a trained eye to really understand what this is. So yeah, I mean, the message, the book, the message, my organization is really intended to be a message that impacts as many people as possible. It's really a crossover audience. So we don't really want this to just reach the sort of the choirs, right? Like, we don't want this to just reach, the scientists or the healthcare professionals, right? Because they're already converted. They already pretty much get it. It's really intended to get the sort of crossover your audience, particularly the pipeline, the students that are coming in, whose perspectives are still being sort of formulated and sort of, are moldable or sculptable.
Yeah, definitely. I get from a concept of education, collaboration, influence perspective, it's really across the board. The earlier that we can get connected to some of the younger minds who are still in this limbo of what am I saying? What am I learning? How is everything going to affect how I practice, right? As a human being, as a clinician, as an individual, to figure out how do I serve my community? And then we can layer on what you're mentioning, also the experts meant to be experts. Why do we do so much work as our organization collecting and then making sure that all the right experts is in the forefront of innovation? Is because most of the time anything new comes out, it seems like the PhDs, the scientists, the clinicians, that niche of people found a gap. And then that gap need to be fulfilled somehow. But if we didn't leverage the bigger community to support, to champion, and you just create a solution, then you go back to them, we're actually missing out on a lot of this messaging, how people feel that same pain. How do they actually become champion if they haven't connected to you? And if we're just bringing people a solution on the back end, it does feel like these experts are not being valued for what they actually been trained so many years for.
Healthcare innovation doesn't happen in a vacuum. Building a great solution is only the beginning. Dr. Evans challenged us to look beyond the technology and understand the environment our innovation is entering. Every health system, community, and population faces different challenges. So when founders need to spend just as much time. So founders need to spend just as much time understanding who they are serving as they do building the product. Now, before we jump into the next 2/3 of our conversation, I would like to take a pause and invite you to be a speaker on our podcast. If you are leading a healthcare organization and have been running multiple clinics yourself, whether it's in the medical, dental, longevity space, We would love for you to contribute, to shine, and help the rest of us to connect all the dots. Go to theprovidersedge.com to apply to be a speaker.
Right? And it's also a differences between any new solution coming out to say, hey, we have a lot of experts on our board. That's great. But do you have just everyone from New York, everyone from Florida, right? Do you have people also across the country, right? So I think it's all about that collectiveness of the right people in the right seat, but also we need to create that ecosystem across the board, across different stages. So then we get the right buy-in, and it's no longer just like a small niche, people saying there is a problem, this is how we're going to solve it, this is the impact we create. It become everyone is on the same page. So that I always believe in is that there's never going to be a circle you cannot tap into. It's just that we have to recognize what we believe in and bring on the right people to continue to support, to champion, and honor these experts for what they're already trained on, and not constantly in the question mode. But that's just also part of the social psychology, right? We know there are the external compliance and internal compliance, and some people are completely external compliant and internal compliant. Some people are just always questioning everything, right? So be able to see where people are at the stage where they are, also be able to notice that some people's question because they're curious, they want to learn, versus other people's question, they're simply just opposition, right? They're just questioning everything and even their own belief system because they start realizing there's a congruency, they're just going to go for the opposite side. And sometimes we just have to say, those are not the people we're ever going to help. And that's okay. And then, because at the end of the day, we all only have a finite amount of resource, time, and money to support the movement that we have. So that being said, what is the next big thing? Right after the books come out, what is something that you're currently working on? What the next big thing that you're working on that people would want to champion for you?
Cool. Well, thanks for that. Just to comment on something that you said, because it's really important. I think that the message and the way that I sort of channel my message is really through empathy, right? As physicians, as healers, we are trained to empathize. And I don't know that a lot of clinicians actually do. I think they try to, but I think that empathy is absolutely key. In the book, and my publishers really sort of encouraged me to do this. I really try to connect a lot of the messages to personal experiences, right? To almost lived experiences. So I had a lot of struggles myself growing up. I look like this, right? People, just assume, white, cis, hetero American physician and living in California. And I naturally had, sort of silver spoon and sort of privilege. I do clearly have privilege now, but I worked really hard to get it. And I had a lot of challenges that the book really sort of shares. So that lived experience really connects to my sort of path or my trajectory as a physician and sort of getting there. And it explains why I feel so passionately about connecting to people that don't have much and people that are historically marginalized, right? Because I do understand that in many ways I could have been them, right? And then from a professional experience standpoint, we're trained to be empathic, again, with our patients. So I kind of use that sort of tool to, again, sort of to connect to the different communities in which I'm sort of delivering the message. And the message of this book, of my general sort of practice, is not really just to get to sort of the liberal left, right? It's really to get to all audiences. And ultimately, I really want to get these messages over to the folks, listening to Fox and Friends and whatnot. Because again, this is public health, just like the fire service should not be politicized, right? Like we all need the fire. We all know what happens if you don't have the fire department that's there. What happens? Your house burns down, right? It's pretty simple, right? So the same thing with public health. You may not feel it for years or decades, but at some point it will become relevant. And then also you have to read the room, right? For certain folks, they may not, understand talking about the social and political determinants or even framing it in those words is going to not connect to them. It may even trigger them. So you have to read the room and really understand what's important to those people. And so the way that I do it, I use almost what we're trained to do in medicine, which is motivational interviewing, right? I'll try to understand, okay, what's important to these folks, right? Like really trying to ask a number of questions from them to understand what's important to them. And it may be the economics, right? And it's often the economics. And if it is that, then I'll connect to the bottom line where I'll say, okay, if you don't invest in this, it's actually going to cause significantly more, for your community. And then also perhaps, connected to from a personal standpoint, and demonstrate that during the COVID-19 pandemic, it wasn't necessarily about investing into certain communities, but the systems, the hospital systems, the ICU systems were so gummed up that if you needed to get into the hospital for just a normal non-infectious reason, it could be an MI or something like that, guess what? The likelihood of getting in was seriously challenged. So that, that I think often sort of gets people's attention. And then the last piece I'll say is like, you have to sometimes really suss out what exactly, when people are asking questions, to your point, are they genuine questions or are they rhetorical, right? Do they just want to hear themselves speak and just sort of like, and just argue with you? And then to your point, like, you just like, we've got a lot of work to do. I would love to influence everybody's, opinion. I would love to do that, but time is limited. And if folks are just there to just fight or argue or be pugilists, then we don't have time. We just have to pick our battles. That's the reality of sort of where we're at. But I think the important piece is just connecting to, again, the science. And again, I will continue to be a science explainer. That's, something that I'm passionate about and I think I'm reasonable at. But I also need to connect that to stories, right? You mentioned that earlier. The stories are super important because, like I was saying in the book, I use some of these lived experiences to connect the reader to what I was experiencing, right? But in sort of live format, I use stories so that people can really understand. It's not just about data points, it's about human lives, right? And I think often if people are able to explain it, connect it in stories that where people are potentially suffering, and hopefully there's like, in any story, there's that sort of that conflict, and hopefully you resolve that conflict, I think people will resonate with that. What's next for me is my day-to-day. I mean, I'm the CEO of an organization called Wellness Equity Alliance. We have 5 strategic priorities. Number 1 is HIV street medicine. So my groups down in the Southern California are operating in either the streets or the deserts, connecting to people experiencing homelessness, unsheltered, unhoused. We focus not just on primary care, but intersecting elements of infectious disease prevention and treatment, as well as street psychiatry and street addiction medicine. Number 2 is public health. I mean, we've always been a sort of public health extender. So now, given all of the impacts, attacks, assaults, dismantling on the US public health system, there are other organizations that are going to need to sort of respond and fill the sort of the void of agencies like the CDC. So that's something that we're currently spending a lot of time on. And our board and our senior leadership have, really, really impressive backgrounds, including many former state health officials and deans of schools of public health and former CDC executives, et cetera. So that's kind of the sort of area in which we are sort of exploring. A lot of work to do, sort of seeing what that looks like, but hopefully we can become the sort of the conveners or the collaborators or coordinators of sort of these aggregating agencies across the country, because we don't want this sort of feudal society of public health where people are like, everybody's doing their own thing. Like, we need to sort of bridge the sort of the science and the sort of the ideas together. Number 3 is tribal health. So we're standing up some tribal health programs in Colorado in 2026, partnering with a Native American tribe. And number 4 is behavioral health, big focus on mental health and substance use. So we're standing up some crisis stabilization units, and then all of our programs have an integrated behavioral health model connected to it. And then finally, rural health. We're, operating in a number of different rural settings. A lot of the folks, we talk mostly about street medicine and other areas that are mostly in urban settings. But what's happened, as a result of a number of sort of political decisions, as well as just resources, has been that folks that are living in the rural areas are left behind. And a lot of the sort of like the critical rural access hospitals and other sort of facilities in these spaces have been shut down or closed down. So it's getting worse. And the Centers for Medicare and Medicaid don't agree with a lot of their decisions recently, but they did just invest a significant amount of money into rural health. They put $50 billion into rural health. So we are going to be pursuing some of those areas. We do have some rural health programs, both in New Mexico and California, and we're looking to potentially expand that again into Colorado and other parts of the country.
Yes, exciting. A lot of moving parts, a lot of initiative for the public side, street medicine, as well as the education side, and expanding to multiple different locations. I always love to end with a fun question. So if we give you a magic wand to grant you a wish to be able to push these initiatives much faster, what would you use the magic wand for?
I would use the magic wand to remove all of this political turbulence of the sort of the obstructions of public health and healthcare. I do think there's been a lot of destruction that's taking place in the last year alone. It's been sort of precipitous, but it's been, particularly the last year, has been really profound. And so I think in order to reverse course on a lot of these pieces, it may take years to decades to get some of this back, if possible at all. But I do think it is possible. It's been just a year. So I do think it's possible to kind of remove some of these sort of political impediments. And I do think there's opportunities to rebuild too. So I think that there's a lot of our sort of infrastructure was not necessarily set up for success, particularly for the most historically marginalized. We know that at least a third, this is before this year, at least a third of populations in the United States do not or cannot engage in healthcare in the way that it's currently set up, right? So we have this incredible healthcare system with incredible, evolutions or developments in biomedicine in the US, more so probably than most countries in the world, probably, definitely. Problem is, many of the folks, if not 50% of the country, don't have access to it. Right. So we need to do better in terms of that. So I think this last year of destruction, I always see a silver lining. And so I think that there's an opportunity to again sort of rebuild and make the healthcare and public health systems stronger than they ever will be. So that's what I use my magic wand for.
Awesome. Thanks, Dr. Evans.
One idea really stood out in this part of our conversation is that don't wait until your solution is finished to involve the people you're building it for. Dr. Taylor shared why lasting healthcare innovation starts with listening, not assuming. The founders who build strong partnerships with clinicians, patients, and communities early are the ones who create solutions that fit real needs and have a better chance to gaining long-term adoption. For anyone out there who has an amazing idea that you wanted to test, each month at 𝐓𝐲𝐥𝐞𝐫, go there to submit your idea and come join us with other clinicians, operators, and investors to see if your pitch really is hot or not. Every month, we have a different theme for longevity, wellness, women's health, men's health, and everything in between. We wanted to make sure that we support you where your innovation can be heard by the people that you're building for, as well as not wasting time going down the rabbit hole of creating a solution that people don't care for. Now go to 𝐓𝐲𝐥𝐞𝐫 to register.
And that's it. Whether you are looking for the next best book to read, go find Dr. Evans' book. And how else can people find you or connect with you the best way?
Sure. So the book's on Amazon, Barnes & Noble, any internet form, digital form that you can look. It's published by Johns Hopkins University Press. You can find us at wellnessequityalliance.com. Also, I'm at tylerevansmd.com. And I'm sure there's a number of other places that you can find me, LinkedIn, other areas as well. I don't do TikTok or anything like that, but you can find me, I'm sure.
Awesome. Yes. LinkedIn is one of the first things that we say us, we're thought leaders and truly making a stand. LinkedIn is definitely number one to be. Until next time, thank you guys for listening in. And we would love to hear about your insight from what we have discussed. What is something that have troubled you from these socioeconomic and then public health effect that has been coming out in the past few years? How do you truly make it the best decision in whenever there are shifts in the system? Post it wherever you're listening to this episode or post it on LinkedIn for us and tag myself and Dr. Evans. We would love to continue this conversation with you. Until next time.
Today's conversation reminds us that healthcare innovation is much more than building great technology. Dr. Evans challenged us to look beyond funding, policy, and product development to better understand the people, communities, and systems our solutions are meant to serve. As founders, operators, and healthcare leaders, lasting impact comes from listening first, understanding the environment we're building into, and designing solutions that solve real problems for the people who will use them. Let's dive into the key lessons from today's conversation. Number 1, healthcare inequity are driven by system, not isolated failures. Dr. Evans explained that poverty, mental health, substance use, and social instability all compound healthcare outcomes. Founders building point solutions must understand the larger environment patients live within. Number 2, trust determines whether innovation gets adopted. Even well-founded public health systems failed during COVID because communities did not trust institutions. Innovation without trust struggles to scale. Number 3, more money alone does not fix healthcare. Dr. Evans emphasized that throwing money into broken system does not automatically improve outcomes because strategic allocation and structure redesign matters more. Number 4, public health and healthcare operations are deeply interconnected. We highlight how operational design, communication, access, and community engagement directly affect disease outcomes. Number 5, optimism must be paired with systems redesign. Despite discussing healthcare inequity, Dr. Evans maintains an optimistic lens focused on rebuilding healthcare systems intentionally rather than reactively. Now, let me ask you this. Are you designing systems around human behavior and what the end users are using, or around what you wish people have been adapted?
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you are a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit sabrinarumback.com/connect and send me a direct message. Talk soon.